Hello friends, today we are going to talk about personality disorder and about specific personality disorders as defined in the ICD-10 criteria. When we are describing personality, there is evidence that the individual's characteristic and enduring patterns of inner experience and behavior as a whole deviate markedly from the culturally expected and accepted range or norm. So what happens? There's a behavior, and this behavior is characteristic and enduring patterns of inner experience. So characteristic and enduring patterns of inner experience and behavior as a whole. They deviate. It should be like this, which is norm, and here it is not norm. And deviated from what? What is culturally accepted? So cultural element, and such deviations must be manifest in more than one of the following areas. And what are those areas? Number one, their cognitions. That is, the ways of perceiving and interpreting things. So you see something, or hear something, or sense anything, or sense things, and then perceive it differently. Meaning, let's say you have experienced somebody meeting a normal person, but you perceive as not able to trust them or feel uncomfortable in their presence. So that is ways of perceiving and interpreting things, either people or events, and then forming attitudes and images of self and others. Remember, these cognitions have been built over the years. When you were a child or adolescent, they have been your inner experiences, and they are manifesting in your behaviors now. But these cognitions were developed some time ago, and now when similar situation or these schemas are triggered, then you start behaving in that way. Number two is the affectivity. And its affectivity means your emotions, your feelings, your comfortness. And the range of this, the intensity of affectivity, and even appropriateness of emotional arousal and response, they all are going to affect. Number three, control over impulses and gratification of needs. That means, can you wait to get the reward, or you grab things when you need it, you don't wait? Do you have control over your impulses or not? Number 3 was control over impulses and gratification. And number 4 is the manner of relating to others. Manner of relating to others and of handling interpersonal situations. The deviation must manifest itself pervasively. So this deviation from the norm is pervasive. That means it's happening again and again, sometimes even subconsciously. As behavior that is inflexible and it is maladaptive. So pervasive means it is happening again and again. Inflexible means even somebody tells you you have difficulty to change that habit. And it is maladaptive. It is causing distress. It is not benefiting the person. Or other dysfunctional across a broad range of personal and social situations. That is, not being limited to one specific triggering stimulus or situation. So it can vary across a broad range of personal and social situations. There is personal distress, or adverse impact on the social environment or surroundings. Surroundings will involve others. They can be family, friends, or both, clearly attributable to the behavior referred to above. There must be evidence that the deviation is stable and of long duration, having its onset in late childhood or adolescence. So onset is late childhood or adolescence, in their teens before age 18. The deviation cannot be explained as a manifestation or consequence of other adult mental disorders. If this deviation is due to other mental disorders like anxiety, depression, autism, then personality disorder shouldn't be considered. It shouldn't be there. The deviation from the norm is because of the inherent, ingrained, characteristic behavior patterns. Although episodic or chronic conditions can happen, so people with personality disorders, they can develop, in fact they can develop more often, symptoms of severe depression, anxiety, moderate depression, and other mental illnesses. And number 6, number 5, no other mental disorder causing above deviation in behavior. Number 6, organic brain disease, injury, or dysfunction must be excluded. So what are the exclusions? So you have to exclude organic brain disease, meaning let's say head injury, epilepsy, or other serious epilepsy or other physical illnesses, infections causing brain damage or stroke, and injury. So we included the head injury here, and dysfunction must be excluded as the possible cause of the deviation. If an organic causation is demonstrable, then it should be like what happens is if there has been serious head injury and there is a personality change. The personality was different before head injury, but once head injury happened, the person is a different person, becoming more aggressive. So that is the diagnostic criteria for the personality disorders.